Have you been prescribed Losartan for your blood pressure or kidney protection? Here's the truth. While millions of people take this medication safely every day, it can also bring side effects that often go unnoticed until they start affecting daily life. In this video, we will break down the 10 most important Losartan side effects you need to watch for. You will learn which ones are common and which are rare but serious, why they happen, and most importantly, what simple steps can help you stay safe while on treatment. All of this information comes from trusted medical sources, including leading health organizations and peer-reviewed studies. You can check the references for yourself in the video description. And just before we dive in, one quick note. This video is for educational purposes only. It is not medical advice. Never stop or change your medication without speaking to your doctor first. Now, let's start with the very first side effect you should know about, and it is one that catches many people off guard right after their first dose. The first side effect to watch for with Losartan is dizziness or lightheadedness. This often shows up when you first start taking the medication or when your dose is increased. The reason is simple. Losartan works by relaxing blood vessels. That helps lower blood pressure and protects your heart, but if the pressure drops too quickly, you may feel off balance. Some people notice it most when standing up from a chair or getting out of bed, what doctors call postural or orthostatic hypotension. For most patients, these feelings are mild and fade as the body adjusts. But in older adults, or in anyone already taking other blood pressure medications, the risk of fainting or even falling is higher. A fall can cause serious injury, which is why this side effect deserves attention. Studies from trusted medical organizations confirm that dizziness is among the most common complaints when patients begin therapy with an ARB like Losartan. It is not usually dangerous on its own, but it is a clear signal that your blood pressure has changed. So what can you do? First, stand up slowly, especially in the first weeks of treatment. Take your time moving from lying down to sitting, and from sitting to standing. Second, stay hydrated, since dehydration makes dizziness worse. And third, keep track of your blood pressure at home. If you notice repeated readings that are too low, or if the dizziness is severe, contact your doctor. The bottom line is that dizziness and lightheadedness are often temporary, but they are also a reminder to be cautious. By paying attention to how your body responds, you can reduce the risk of falls and make sure Losartan is doing its job safely. The second side effect to be aware of is cough. Most people think of cough as a problem with ACE inhibitors like lisinopril, but it can still happen with Losartan, even though it is less common. The difference lies in how these drugs work. ACE inhibitors increase certain chemicals in the lungs, especially bradykinin, which can irritate the airways and trigger a dry, persistent cough. Losartan is an angiotensin receptor blocker, or ARB, and it does not usually raise bradykinin levels. Still, research shows that a small number of patients on Losartan report an ongoing cough that does not seem to improve with time. For those affected, the cough is often dry and nagging, sometimes worse at night, and it can interfere with sleep or daily activities. Because coughing is so common in general, it can be hard to tell whether the medication is the cause or if something else like allergies, reflux, or lung disease is to blame. Doctors often check by asking when the cough started and whether it improves after stopping or switching the medication. If Losartan is the cause, the cough will usually fade within days to weeks after the drug is discontinued. It is important not to stop the medication on your own, since uncontrolled blood pressure can be more dangerous than the cough itself. If you notice a persistent cough that does not go away, let your doctor know. They can decide whether to continue, adjust, or switch to another option. The key takeaway is that while cough is much less frequent with Losartan compared to ACE inhibitors, it can still occur. Being alert to this side effect allows you and your healthcare provider to separate normal seasonal coughs from a medication reaction, and to keep your treatment both effective and comfortable. The third side effect linked to Losartan is high potassium, also called hyperkalemia, This happens because losartan blocks the action of angiotensin II, which normally causes the kidneys to hold on to sodium while getting rid of potassium. When that signal is blocked, the body may retain more potassium than usual. For most people with normal kidney function, the rise is small and not dangerous. But in older adults, or in patients who already have kidney disease, diabetes, or who take other drugs that raise potassium, the risk becomes more significant. Medications such as potassium supplements, certain diuretics like spironolactone, or even salt substitutes that contain potassium can push levels even higher. Too much potassium in the blood can affect the way the heart beats. Symptoms may include muscle weakness, unusual fatigue, tingling sensations, or, in severe cases, dangerous heart rhythm changes. The problem is that high potassium can also develop silently, without obvious warning signs, until it shows up on a blood test. This is why doctors usually check kidney function and potassium levels after starting or adjusting losartan. A simple blood test can confirm whether everything is staying within a safe range. What can you do as a patient? Follow your doctor's advice about diet, especially if you have been told to avoid high potassium foods such as bananas, oranges, or tomatoes. Do not use salt substitutes without asking your doctor first. And keep up with regular blood work, even if you feel fine. The key takeaway is that losartan can increase potassium levels, particularly in people with kidney problems or those on certain other medications. Monitoring and awareness are the best tools to prevent a hidden lab change from turning into a serious health issue. The fourth side effect to understand is low blood pressure, also called hypotension. Since losartan works by relaxing and widening blood vessels, the intended effect is to bring blood pressure down. But in some people, the drop can go too far. This is most likely to happen in certain situations. If you are dehydrated from not drinking enough water, heavy sweating, vomiting, or diarrhea, blood pressure can fall quickly. The same is true if you are on multiple blood pressure medications at the same time. Older adults and people with heart failure are especially sensitive to sudden changes in pressure. When blood pressure is too low, the symptoms can be obvious. You may feel lightheaded, weak, or unusually tired. Some people describe blurred vision, difficulty concentrating, or even fainting. These episodes can be frightening, and in seniors, the greatest risk is falling and getting injured. Doctors monitor for this effect by checking your blood pressure both in the office and at home. It is common for patients to feel fine while sitting, but to notice dizziness when standing, which is why postural or orthostatic hypotension is closely watched. What should you do if you notice these symptoms? First, make sure you are drinking enough fluids unless your doctor has restricted them. Second, rise slowly from sitting or lying down, giving your body time to adjust. And third, keep a log of your home blood pressure readings so your healthcare provider can see the pattern. If your numbers are consistently lower than recommended, or if you experience repeated fainting or severe dizziness, contact your doctor right away. They may adjust the dose, change the timing, or consider an alternative. The bottom line is that losartan is designed to lower blood pressure, but in some cases it can lower it too much. Recognizing the warning signs early and working with your doctor can prevent small issues from becoming more serious. The fifth side effect to be aware of is changes in kidney function. Losartan is often prescribed to protect the kidneys, especially in people with diabetes or high blood pressure. It reduces pressure inside the tiny filtering units of the kidneys, called glomeruli, and over the long term, this can slow down damage. But in the short term, it may also cause certain lab numbers to rise. One of the most common changes is a slight increase in creatinine, which is a marker of kidney function. For many patients, this small rise is expected and not harmful. It shows that the kidneys are under less stress. However, in some cases, especially if you already have advanced kidney disease, dehydration, or you are taking other medications that affect the kidneys, the increase can be larger and may signal a problem. Losartan can also raise potassium levels at the same time, which adds another layer of risk for the kidneys and the heart. Because of this, doctors almost always order blood tests a few weeks after starting losartan, and then regularly during treatment to make sure the kidneys are tolerating the medicine. Symptoms of kidney strain are not always obvious. Some patients may notice swelling, fatigue, or a change in how often they urinate, but in many cases the only way to detect changes is through lab results. That is why follow-up appointments and blood tests are so important. What can you do as a patient? Stay hydrated, follow your doctor's instructions on diet, and make sure to attend all scheduled checkups. If you are taking other drugs like non-steroidal anti-inflammatory drugs for pain or diuretics, always ask your doctor or pharmacist whether there could be an added risk for your kidneys. The takeaway is that Losartan usually protects the kidneys, but in some cases it can temporarily affect kidney function. Regular monitoring allows your healthcare team to spot problems early, adjust your treatment if needed, and make sure the benefits outweigh any risks. The sixth side effect to recognize is fatigue and weakness. Some patients notice that after starting Losartan, they feel more tired than usual or have less stamina for daily activities. This can range from mild sluggishness to a more persistent lack of energy that interferes with quality of life. There are a few reasons this can happen. First, when blood pressure drops, even to a normal level, the body may need time to adjust. Lower circulation pressure can leave you feeling drained until your system adapts. Second, changes in electrolytes, especially potassium, may affect how your muscles and nerves function. Higher potassium levels can cause muscle weakness or a sense of heaviness in the arms and legs. Studies and patient reports show that fatigue is one of the more commonly described side effects of Losartan, although for many it improves over time. It can be difficult to tell whether the tiredness is from the medicine itself, from the underlying condition like high blood pressure or kidney disease, or from other medications taken at the same time. What should you do if you notice this? Keep track of when the fatigue started and how severe it is. Share this information with your doctor, especially if it does not improve after the first few weeks. Sometimes adjusting the dose, changing the time of day you take the medicine, or ruling out other causes such as anemia or thyroid issues can make a big difference. The key point is that fatigue and weakness can be part of the body's adjustment to Losartan, but they should not be ignored if they persist. With careful monitoring and open communication, you and your healthcare provider can decide whether the medicine is the cause and what changes might help restore your energy. The seventh side effect to consider is muscle or joint pain. While not among the most common complaints, some people taking Losartan report new aches in their muscles or stiffness in their joints after starting the medication. The exact reason is not always clear. In some cases, shifts in blood pressure and circulation can leave muscles feeling sore or less well supplied with oxygen during exertion. In other cases, changes in electrolytes, especially higher potassium levels, may contribute to unusual muscle sensations. Joint pain has also been reported, though less often, and it may overlap with the natural effects of aging or arthritis. One challenge is that muscle pain can have many possible causes. People who are also taking cholesterol-lowering medications like statins may be more likely to confuse the source, since statins are known to cause muscle aches. Distinguishing whether Losartan, another medication, or an unrelated condition is to blame often requires careful tracking of symptoms and a discussion with your doctor. Most reports of muscle or joint pain with Losartan are mild and manageable. Simple measures like staying well hydrated, gentle stretching, or adjusting activity levels can help. If the discomfort becomes severe or persistent, your doctor may order blood tests to check electrolytes and kidney function, or consider switching medications. The important message is that while muscle or joint pain is not the most frequent side effect of Losartan, it can still affect some patients. Paying attention to your body and reporting changes promptly ensures that problems are identified early and that your treatment remains safe and effective. The eighth side effect to look out for with Losartan is swelling, also known as edema. Although this problem is more common with other blood pressure medications such as amlodipine, Losartan can sometimes cause fluid to build up in the lower body. Swelling often shows up around the ankles, feet, or lower legs. patients may notice that their socks leave deeper marks at the end of the day, or that their shoes feel tighter than usual. In some cases, the swelling may extend higher up the legs and cause discomfort when walking. Why does this happen? Losartan changes the way the kidneys handle salt and water. In certain people, especially those with weaker kidney function, this can lead to fluid retention. Other medications taken at the same time, such as anti-inflammatory drugs, can make the swelling worse. Most of the time, the swelling is mild. But if it becomes persistent, it may add to discomfort and raise concerns about circulation or kidney health. Doctors usually check for edema during routine visits and may recommend reducing salt intake, adjusting other medications, or in some cases, adding a mild diuretic to help the body release extra fluid. The important point is that while swelling with Losartan is less common than with some other medicines, it can still occur. Noticing it early, keeping track of when it appears, and discussing it with your doctor will help prevent small changes from turning into larger problems. The 9th side effect to know about is allergic reaction. Although rare, this is one of the most serious risks linked to Losartan. An allergic reaction can appear in different ways. Some people develop a skin rash, redness, or itching soon after taking the medication. Others may notice swelling of the lips, tongue, or face. In the most severe cases, called angioedema, the swelling can block the airway and make breathing difficult. This requires immediate emergency care. Doctors are especially cautious with patients who have had reactions to other drugs in the past. Even though Losartan is generally well tolerated, allergic responses can occur with any medication. Because they are unpredictable, it is important to know the warning signs. If you ever experience sudden swelling, difficulty breathing, or a widespread rash after taking Losartan, seek medical help right away. Do not wait to see if it improves on its own. For milder reactions, such as persistent skin irritation, talk to your doctor as soon as possible. They may confirm whether Losartan is the cause and decide if an alternative medication is safer. The bottom line is that allergic reactions to Losartan are uncommon, but they can be dangerous when they do occur. Knowing what symptoms to watch for and acting quickly can make all the difference. The 10th side effect to be aware of includes rare but serious risks involving the liver and pregnancy. In a small number of patients, Losartan has been linked to liver problems. Signs may include yellowing of the skin or eyes, dark urine, or persistent nausea and fatigue. These symptoms suggest that the liver is under stress and require immediate medical attention. While this reaction is very uncommon, it is important to know what to look for, because liver damage can become serious if not treated quickly. Another critical warning is related to pregnancy. Losartan, like all angiotensin receptor blockers, is strictly not recommended for women who are pregnant or planning to become pregnant. The drug can interfere with kidney development and blood flow in the fetus, leading to serious complications or even loss of pregnancy. This is why the FDA issues a strong boxed warning, the highest level of caution for Losartan in pregnancy. Doctors usually advise women of childbearing age to use safe alternatives if they need blood pressure control. If pregnancy occurs while taking Losartan, the medication should be stopped right away under medical supervision. The key message is that while these risks are rare, they are serious enough to deserve special attention. If you notice signs of liver trouble or if pregnancy is a possibility, contact your doctor immediately. Knowing these warnings helps ensure that Losartan is used safely and effectively in the right patients. You've now seen the 10 most important side effects of Losartan, from the common issues like dizziness and fatigue, to the rare but serious risks involving the kidneys, liver, or pregnancy. The good news is that most patients take Losartan safely for years, and many of these side effects can be managed with regular monitoring and open communication with your healthcare provider. Remember, never stop or change your medication on your own. Always talk with your doctor before making adjustments and keep track of how your body responds. Your blood pressure medicine should make you healthier, not hold you back. If you found this breakdown helpful, give the video a like and share it with someone who may also be taking Losartan. And don't forget to subscribe for more clear, evidence-based explanations of the medicines you use every day. That way, you'll never miss our next update. For full references, check the links in the video description, including Mayo Clinic, NHS, FDA, Cleveland Clinic, and PubMed. We've gathered the scientific sources so you can read them for yourself. This video is for educational purposes only and is not medical advice. Always work with your healthcare provider to make the best decisions for your health. That's it for today's breakdown. If you are interested in other blood pressure medications, don't miss our in-depth video on amlodipine side effects. Click here to watch next. And for a broader look, explore our playlist on blood pressure treatments. It's the best way to stay informed and protect your health.